This topic is about face masks. The CDC guidelines have been updated. Previously, December 27th of 2021, the CDC notified the updated guidelines connected with face mask. What is so important about this information? Well, first of all, let's look at the map behind me on the wall. As you can see, a picture of the United States, everything is marked in red, which basically displays that the COVID community transmission rate in the United States, as of right now, is in red, which is classified as a high transmission rate, which is very bad. And it seems that the transmission rate was caused by the variant known as the Omicron. Now, the Omicron variant just came on the scene previously in November to now, to the present. And since then, the numbers have been going up. Research and scientists have investigated to figure out that one possibility is due because of the face masks that we're wearing. There are three different types of face masks. The first one is the conventional blue disposable face mask that you use and then you dispose. The second type of face masks are the ones made of a cloth fabric, where you're wearing them for approximately about a week. You've been washing them about a month or two before you dispose of them. The third type of mask is the type that I'm holding in my hand now, which is known as a respiratory mask, which is the official scientific word for surgical mask, for surgeons, for frontline hospital workers, for doctors and nurses and so forth, which prevents any type of germs of being transmitted while working in the hospital or in a surgical room. Now, those three masks have been approved by the CDC historically. Most of the people in the public have been using the first and second type of mask that I've shown you, the disposable and the cloth mask, which is fine. But science has now found that the Omicron variant, the droplets are more microscopic than the previous variant of the Delta variant. Therefore, the Omicron droplets, being so microscopic, are filtering in through the face mask much more readily because of the disposable mask and the cloth mask being loosely fitted. So the CDC has updated the guidelines for the mask and is now recommending the N95 mask to be worn instead, because of the tight wove for the Omicron variant to transmit through, while at the same time, the disposable mask is more transparent and not as tightly woven or as dense as the KN95 is. Unfortunately, the N95 mask is not cheap. Whereas opposed to the disposable mask, they average about 5 to 10 cents per mask, which you can purchase by the dozen, 100 for $50 or so forth, or less. Now the cloth one, many people are making them at home and selling them for $1 or $2 to $3. They last a lot longer. They can last up to 3 months, but the N95 mask on an average costs about $1.25 to $1.50 per mask. So if you buy 10 of them, you're looking at $10, 100 at the cost of $100. That's quite costly and quite expensive. And most people cannot afford that. I, for one, cannot. I buy a few at a time, but would I be able to buy a lot of them? Probably not. But the research shows that these masks should be worn 3 to 5 days at the most, and then they should be disposed of, and then a new one should be used. So every 3 to 5 days, a K95 should be thrown away. But it's not necessary to buy K95. You can use 2 disposable masks and a cloth mask. So in other words, you can have 2 disposable masks or a cloth mask over a disposable mask. That'll give you just as much protection as an N95. If you don't have the money to buy a K95. And that's the type of mask that you would use at work, maybe going into a grocery store, department store, 2 mask coverings, going to sporting events outdoors and so forth is okay. And if you're, distanced properly, you can have 1 mask inside, where you work at. If you're going into a, luncheonette room or a cafeteria, you should wear 2 masks when you're in an area where public congregation is going on. Now, about the N95, there are 3 types of numbers that you need to be mindful of that are made in the United States and that are recognized. One is the N95, the other one is the KN95, and the KF94. Now, you may be asking, what is the difference between these 3 masks? The K95 and the KN95 are similar. They are both made in China, and they meet US standard guidelines. And they have met the seal of approval. The third one, which is the KF94, is a Korean-made mask. And it's the same as the KN95, but the only difference is that the KN95 and the KF94, with the difference of the K95, is that the letter stamping is very important to be recognized. When you notice the word NIOSH, which means the National Institute for Occupational Safety and Health, which is a federal agency that oversees the Department of Labor, the Department of Health, in connection with germs and filterization and so forth, and working in those type of environments. They must have that seal of approval. So when you're working in those environments of safety and occupancy health, they must have that seal that's by NIOSH. So when you're shopping online to purchase that, check to see that you're getting the right product, because right now there is a lot of fraudulent activity going on and scams of counterfeits. So if you see a number like an N84 or an N85, those are counterfeits. It has to be a 95 or a 94. So it would be a K95, KN95, or a KF94. And the KN94, which is NIOSH, you have to look for that US patent number. It'll have that on there as well. It's important to make sure that it has that. Do not spend your money otherwise. You see this outline on the wall? This is the CDC guidelines on the approved masks that could be worn during COVID and those that are not approved. So the CDC is recommending some masks to be worn and others not to be worn. This mask here, if you notice, has a ventilation system on there. It is an N95, KN95, with a ventilator. Helps you to breathe. The CDC recommends not wearing this. You can wear this for everyday use, but because of the COVID transmission that's taking place, it is now recommended not to use this type of a mask. Now, you've noticed that some people are using face shields, as outlined in the picture behind me. That is also not recommended to purchase or utilize. They serve no purpose because of the fact that there is no protection. The Omicron variant can easily be accessible for transmission around, above, and on the side of the face shield. However, if you're using a mask with the face shield, then that is okay because of the fact that you are protecting your eyes, and that is okay under those conditions. But a face shield alone should not be worn unless you are wearing a mask underneath the face shield. Lastly, for those of you who are working in hospitals or doctor's offices or labs and so forth, or working in factories such as Amazon, where you are working among a lot of coworkers, or you're in a school environment, you're a teacher or a staff, or working with a large group of students, the CDC recommends that you do use the N95 or the KN95 or the KF94. Those are the masks that are highly recommended to use in those type of environments to prevent the transmission of the Omicron variant. Now, those of you who may be taking care of elderly people in nursing homes or working as caregivers, going into people's homes, it is recommended that you use the N95, the KN95, or the KF94, not the cloth nor the disposable, to protect the people that you are serving, because they are at high risk and may cause eventually death in some cases. When you're in public transportation, such as airports, buses, trains, and subways, any type of public transportation system, you should use those three that I had mentioned: the KN95, the N95, and the KF94. Now, when you're dealing with people who have a low immune system, such as yourself or the people you're around, you should also wear those three masks that I recommend and not use the cloth or the disposable mask to keep yourself from transmitting it to others and having others transmit it to you. Now, for the rest of the people who are working in normal environments or working from home or working in offices with very few people, you can wear disposable or a cloth mask in those type of environments, preferably doubling up on those disposable masks or using a disposable mask on top of your cloth mask. So when you go, for example, when I go into a grocery store to buy my groceries, I put on a disposable mask and then I put my cloth mask over that. I do my shopping, or sometimes I go to a department store, or I'm going into, like, Home Depot or something. I always wear two masks. I double up. All of this is to protect yourself and to protect others, and to defeat the Omicron variant in terms of getting it under control so we can get back to close to living as normal as possible. If you have any questions and you need clarification, feel free to reach out to me at my office. I will be happy to have a conversation with you. My phone number is 401-216-5414, or you can send me an email. My email is as follows: stay healthy and stay safe. Thank you.